Hello, welcome to Chapter 9. Chapter 9 discusses atypical sexual behavior. So we'll be looking at paraphilias. We'll talk about exhibitionism, sadomasochism, fetishism, voyeurism, Froeterism, pedophilia, and then a category that's just called not otherwise specified. So how do we define what is normal sexual behavior? There are actually 4 ways that we do this. Sociologically, so whatever falls within our laws, our morals, and our customs of society. Biologically, healthy behaviors that help perpetuate the species. Psychologically, doesn't result in any type of emotional or physical distress. And then statistically, so when you rely on statistics, you're relying on what is normal, or what the majority of people engage in, or in a culture. But dichotomizing sexual behavior as normal and abnormal is stereotypically easy, but not politically correct or polite. You may have already run into this. So we use the term atypical as it's not as offensive and refers to behavior that is not statistically typical. So what are paraphilias? Recurrent, intensely arousing sexual fantasies, urges, or behaviors that involve at least one of the following 3. Non-human subjects, suffering or humiliation involving the self or someone's partner, and then children or other non-consulting adults. Paraphilias are almost always the focus of one's sexual arousal, repertoire, and orgasm are difficult, if not impossible, without the paraphilia. So it's tied to someone's arousal, tied to orgasm, masturbation, and it's hard to have an orgasm if you don't include this at least in your fantasies. To qualify as a paraphilia, behavior has to occur, over a period of at least 6 months and cause significant clinical distress or impairment in social, occupational, or other areas of functioning. So this is really important. In order for it to qualify as a paraphilia, it has to happen or have happened or occurred at least a period of 6 months, and it has to cause some type of clinical distress or impairment in the social, occupational, or work, or other types of functioning. So if somebody has let's say a shoe fetish, for example, and they love to include shoes in their fantasies, and maybe even in their lovemaking with their partners, and their partner's completely fine with it, that it wouldn't be classified as a paraphilia unless the person was suffering in some way from it. Maybe they were feeling distress about it, and it was affecting their relationship with their partner, or affecting work, or even other types of relationships. Otherwise, it's not a paraphilia. So let's start with a common one. When I say common, I mean most people know it. Exhibitionism. So this just involves exposing yourself to somebody that is non-consenting. It can be one person, it can be many. Part of the arousal is the surprise of the victim. In part of the exhibitionist fantasy is that the victim, they imagine that the victim is aroused. A third of reported offenses involve exhibitionism. So 1/3 of offenses that are reported to the police are exhibitionism, but only 20% are reported. So this means that there's this huge chunk of exhibitionism occurring that isn't actually reported. Sadomasochism, otherwise referred to as S&M, this refers to sexual arousal that's associated with suffering and humiliation, and that would be somebody that the sadist would be somebody that has the control, and the person that submits would be the masochist. The behavior occurs within a sexualized context. All sexual orientations are likely to engage in S&M. It's not affiliated with one type of sexual orientation. And in American population, approximately 14% of males and 11% of females engage in S&M. That they report. So you always have to wonder who's not saying something. It's the only paraphilia that involves a significant amount of females, surprisingly. And so, again, the sadist likes to inflict suffering and humiliation in a sexualized context. The masochist enjoys pain, discomfort, or humiliation in a sexualized context. And there is a continuum of sadist behavior. So minor sadism would refer to like using soft objects to beat or spank or whip a partner or humiliating a partner. And then on the more extreme or major sadism, you'd have one that would be considered a murderer if the only way they can experience orgasm is through their victim's extended suffering and even dying. And so it can get out of hand. It is important that among consenting adults only, that it's safe, sane, and consensual. And so everybody has to agree. There has to be a line that cannot be crossed, and there has to be some type of word. And so you have to agree with whomever you're engaging in this type of sexualized behavior with, that if you use a certain word, the other person agrees to stop completely. This allows the sadist to go far and the masochist to go as far as they want without responsibility, and they can even engage in the fantasy and say no, 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 when, let's say, the safe word is bumblebee. So until bumblebee is heard, it's part of the role play in the sexualized context. There is the Janus Rules, the Society of Janus Rules. I've put up the website here, and you can check that out for information regarding rules, what the ethics involved, and what more behavior information as well. So kind of just, if you're really curious about this, you can get more information there. I have also asked a woman that lives in California. I went to high school with her, and she actually is a sadist. And so she is actually going to record a lecture that I will put up on D2L regarding that experience. I thought it would be interesting for you guys to hear from an actual admitted sadist that's open with it. So that's to come. Something to look forward to. Okay, fetishism. Fetishism refers to fixation on an object or body part that's not typically sexualized in nature. So there are common types. There's media fetishes, which have nothing to do with the media. I don't know why they're called media. Leather, rubber, fur, silk, etc. There are form fetishes. That's what shoes would fall under. Shoes, garters, boots, underwear, etc. And then there's partialism, which refers to another body part. And so that's where like feet would come in, buttocks, hair, hand, etc. Most common fetish objects: women's undergarments are the most common. High-heeled shoes follow closely. Then silk, leather, and fur. So that's the top 5 most common fetish objects. It's actually pretty common to have a fetish with some type of either material, body part, etc., that help somebody achieve orgasm and enhances their sexual play and sexual behavior with their partners or without. So remember, it's only a paraphilia if it causes some type of discomfort. If somebody's completely comfortable with their fetish with leather and their partner's comfortable with it, it's doing no harm. There's absolutely nothing wrong with it, and it shouldn't be considered weird or taboo. It's actually very normal. We just tend not to talk about it in society very much. So it has to cause some type of harm in order to be considered some type of paraphilia. Voyeurism refers to deriving sexual pleasure from watching people either undress, shower, walk around naked, or even be involved in some type of sexual play or behavior. The idea, though, the main idea is that the voyeur is watching without the victim's consent. Hard to say victim, but it is a victim. Certainly, I would not be comfortable with somebody watching me if I didn't know and I was walking around in the nude. So they're almost always strangers. There's no consent. And there has to be some kind of element of danger. So the observer has to experience some kind of risk of getting caught in order for it to be the true voyeurism experience. The men that engage in this behavior typically are unmarried males in their 20s and 30s. And so, again, it's just sexual excitement by watching usually naked women, but it can include men as well. And remember, I said with the paraphilias, S&M or Sadomasochism is one of the only ones that have large number of females that engage in that. So most of these are going to involve men for the most part. There are some women that do engage in this behavior, but it's much more common among men. Okay, Froeterism, deriving sexual pleasure from rubbing one's genitals against an unsuspecting, non-consenting person. So this is the kind of behavior you might experience or witness in crowded places, typically buses, subways, large crowds, games like football games, basketball games, where large numbers of people or concerts. And it's males typically rubbing their genitals against an unsuspecting, almost always females' buttocks, but it also can include males' buttocks. And really this is, I'm not even aware of women engaging in this behavior. It's almost always men. If you have research that shows that that's different, I would be interested in seeing that, because everything I've come across has indicated that it's a male behavior. And of course, the pleasure comes from rubbing up against an unsuspecting person and imagining that they like it. They're aroused by it, even though they're not. And most people don't report this, surprisingly. It's something that happens, and women typically brush it off like, ooh, creepy guy on the bus, instead of running to the police about it. So that's unfortunate because we don't have a lot of accurate statistics regarding how often it occurs. But if you ask women that live in the city, they will tell you it actually occurs quite a bit. It's pretty common for females to experience this. I'm sorry, I thought I had something about fixated and regressed. Add this to your notes. There's also fixated and regressed. Fixated refers to being sort of frozen at an earlier stage of development. And so these pedophiles typically prefer boys, and when they engage with them, they kind of relate to them as though they're a little boy themselves. So that's fixated. I always think fixated, frozen, kind of stuck at an earlier stage of development and preferring boy victims. On the other hand, regressed refers to pedophiles that prefer girls, but they relate to the victims as though the girls are adults. So they're kind of bringing the girls up into adulthood, even though they're not adults. And so they would refer to their victims like as a girlfriend or even as a wife, as a lover, as though it's completely normal. So fixated, preferring boys, being frozen, earlier stage of development, relating to boys from one little boy to another. Regressed, preferring girls and relating to them as though the girls were adults. Most pedophiles are heterosexual men. And I have to say, I tried to pause it here because I was going to look something up, but I'm having problems. So there is this common misconception that pedophiles are homosexual men. There's actually no research to support that. It's a myth, it's a misconception. The majority of pedophiles are heterosexual men. And so whether they're fixated or regressed, they identify as heterosexual. And this is always unfortunate because you hear stories about a teacher coming out as gay and parents in the community freaking out thinking they're going to abuse my child, when really they should be more concerned about the heterosexual male teacher because he's more likely to abuse children than a homosexual male teacher. A little tidbit for you. Women that engage in sexual abuse typically show evidence of some type of mental illness, or they're engaged in the behavior to please a male partner. So sometimes they're in a position where they are either forced or they feel like they're forced. Their perception is they have to do this to stay in the relationship, to stay safe, to stay alive. It's unusual, though. Most perpetrators are male, but there are a number of female perpetrators too, and we're actually, through time, more and more research is surfacing about female pedophiles. What's interesting about pedophiles is they have this distorted cognition. They actually believe that sexual contact benefits the child and that the child enjoys the contact. They also refuse to assume any type of responsibility for the contact. They'll always blame the victim. And they perceive that the child sought or solicited the contact. So that's how they're able to cope with its experience. They have this distorted cognition or beliefs about the situation. Alcohol is involved in 30 to 50% of the cases. However, it's important to note that just because it has been involved doesn't mean it's alcohol to blame. Alcohol lowers inhibitions, and it's often a way that people self-medicate when they're coping with something that's uncomfortable or they don't like about themselves. A third of pedophiles have a history of being sexually abused themselves as children. So that means a majority don't have a history of being sexually abused, but there are some that do. There's always this common belief that the perpetrator had to have been sexually abused, but that's not the case. As far as treatment for survivors, you'll have the educational video I mentioned earlier to watch as well. Treatment varies according to the type of abuse that was experienced, how long it was experienced, the degree of interpersonal support that's available to the victim, the personality of the individual, and the resulting psychiatric condition that arose as a result of the abuse. It's important to note that survivors of abuse at any age who show signs of having a serious psychiatric problem or problems should be referred to a psychiatrist for help. It's very difficult to just heal on your own, and it's very normal to seek help when you are in the process of healing. And healing is a process. It's not a situation where you go to a few therapy appointments and you're cured. Different variations or types of reactions occur as people age. So how they show their survival can change over time. And recall how common sexual abuse is. So 1 in 3 women, 1 in 6 men. One of the ways that psychiatrists or therapists uncover sexual abuse is when people are suffering from panic attacks, post-traumatic stress disorder, suicide ideation, meaning they think about suicide, all kinds of, feeling dirty, feeling shameful. Oftentimes you can tie this to some type of incident that happened in a child's past. But it's actually not important to pinpoint it. It's more important to treat. No treatment for the pedophile is actually effective unless they want it and they engage directly in it. So while the treatment may be helpful for the victims and the survivors, no treatment has been proven effective empirically and won't work at all unless the pedophile wants it. There are 4 general courses of treatment. Therapy can include individual, group, or a combination. Generally uses a cognitive behavioral approach, which means that the therapist would address distortions and denial and try to teach the pedophile to stop acting on impulses. Empathy training is also sometimes used so that the pedophile feels empathy for their victims. There's a lot of debate about the effectiveness of therapy. There's not a lot of support saying it's effective. People can stop the behavior, but they can't stop the intrusive thoughts. And oftentimes, holding them back does actually lead to acting on impulses later. Chemical castration refers to drugs that have a testosterone suppression. Has many advantages over physical castration, but it does require continuous monitoring, follow-ups, reevaluations. but it is reversible in the event of some type of health issue. Then the physical castration, of course, would be removing the testicles. That's not reversible. That's pretty permanent. And then serotonin reuptake inhibitors, non-hormonal treatment that appears to reduce urges and lessen sexual ruminations. Ruminating means just thinking over and over again about it. The best outcomes and repeat offenses against children occur when there is some type of medication involved and therapies combined. That seems to be the best to date, what we have. But you have to remember you're relying on somebody to take their medication and follow what their therapist is recommending. So that's why I say they have to be actively engaged. Okay, this last category is the not otherwise specified. This refers to different types of paraphilias that aren't as common and so don't have as much research on them. Telephone scatologia refers to obscene phone calls. Necrophilia refers to fantasizing about intercourse or having intercourse with corpses. Zoophilia refers to sex with animals. Coprophilia refers to contact with feces. Klysmophilia refers to enemas. And then urophilia refers to undue attention to urine. So again, they have to cause some type of distress, be engaged with for at least 6 months before they can be classified as some type of problem. I mention this because somebody who enjoys, who has a urophilia, for example, and maybe enjoys urine in their sex play, it's not harmful if anybody that's involved has no objection. So it's always important to point that out. So as far as the etiology of paraphilias, the psychoanalytic theory or perspective is that a person is stuck at a certain point in development, and so it hasn't been resolved, and that's why they develop some type of paraphilia or fetish. The behaviorism theory focuses on learned behavior. So the idea is that the person learned it from something that happened and they've associated it with sex. So extremely harsh punishment. The behaviorism theory would be that because the child was spanked a lot, then they might enjoy spanking during sex as adults. Observing their mother in the shower might lead to voyeurism in adulthood. And then there's this eclectic perspective. John Money developed a biological theory of sexual and gender development and said that when children begin to link sex, love, and lust, or desire, they develop a unique, what he called a love map, based upon a combination of biology and psychosocial learning, and said that paraphilias develop when lust and love are imprinted as two separate entities and lust becomes distorted, and that this could be due to an experience of incest, lack of affection from parents or between parents, a repressive household, controlling household, other types of psychological harm during childhood. So regardless, there seems to be some tie to childhood, whichever theory you buy into. As far as treatment, most enter treatment because they've been arrested. They've been caught doing something. Maybe voyeurism, maybe exhibitionism, pedophilia, but that's how they get into treatment. It's difficult to treat and cure people that are caught and forced into therapy because they didn't choose to be there. And because paraphilias originate fairly early on in development, the prognosis for a limiting behavior that has been reinforced over time is not good. I would like to sit here and deliver you good news and say that there's lots of effective treatment, but like when we talk about battering with women and intimate partner violence, you'll find that unless the person, just in alcoholism too, unless the person buys into it and says they want help and they want to change and they're willing to actively engage and keep actively engaging in whatever the treatment that is prescribed for them, ends up being, it's just not going to work. So that concludes our talk on paraphilias. Be looking forward to the lecture I post from the sadist in California. She will be talking about her experiences with S&M. Okay, thank you.